Cancer has got a new enemy in the last couple of years, all thanks to a technology used by the Romans 1600 years ago, only to be solved by the modern scientists in 1990s. This chalice shown here is called Lysergus cup, and it has a unique property. It appears red when illuminated from behind and green when illuminated from the front. This mystery was solved when the fragment of the chalice was observed under microscope, revealing tiny alloys of silver and gold metallic nanoparticles fused with glass. Nanoparticles had advanced much now, especially gold nanoparticles, which turn out to be an important component in cancer treatment. Cancer is a disease characterized by uncontrolled growth and spread of abnormal cells. So how these tiny God shells are helping treating cancer? Let's see.
Photothermal therapy or PTT is a minimally invasive therapeutic surgery in which photon energy is converted into heat sufficient to destroy cancer cells. Upon irradiation to electromagnetic radiation, strong surface fields are induced due to the coherent excitation of the electrons in nanogold. The rapid relaxation of these excited electrons produces strong localized heat capable of destroying surrounding targeted cancer cells via hyperthermia or other thermal based effects. This photothermal therapy induced by plasmonic gold nanoparticles is called plasmonic photothermal therapy or PPTT. Compared to non-metal nanoparticles, plasmonic nanoparticles exhibit a unique phenomenon called localized surface plasmon resonance or LSPR or simply SPR. SPR is the result of interaction of metal with light of resonant frequency. Light passing through a prism at a certain angle theta, the resonant angle, cause free electrons to exhibit a collective coherent oscillations around the surface called surface plasmon, and the phenomenon is termed as surface plasmon resonance or SPR. In gold nanoshells, this plasmon resonance lead to a strong extinction band around 520 nanometer in the visible spectral region, which is the reason for the brilliant red color of the nanogold solution.
Let's see how exactly it's done. First, gold nanoparticles attached with antibodies are injected in blood to be transported to tumor. There they get attached selectively to cancerous cells thanks to attached antibodies on the surface of gold nanoparticles. Now burst of laser is shot at them. Plasmonic nanoparticles have useful non-radio photothermal properties. The absorbed light is converted into heat. Hot electron temperatures of several thousand degree Kelvin are easily reached in the nanoparticles even with laser excitation powers as low as 10 to the power 2 nanojoule. The heat dissipated from the nanoparticles heat up the species surrounding it. Such fast energy conversion and dissipation can be readily used for the heating of the local environment by using light radiation with a frequency strongly overlapping with the nanoparticle SPR absorption band. When the nanoparticles are attached to cancer cells, the heat can change the function of the cells and even destroy them depending on the amount of heat generated by the hot nanoparticles. Here the cancerous shell is bursting due to evaporation of its fluid from heat generated. Now, why should we use it? There are some cancers in which chemotherapy is ineffective, but PPTT can work. It is 17 times more effective than conventional therapy. No harmful effects on healthy cells as it acts selectively on cancerous cells, thus no side effects.
The LSPR is dependent on factors affecting the electron charge density on the particle surface, such as the particle size, shape, structure, and the dielectric properties of the metal and the surrounding medium. Spherical gold, silver, and copper nanoparticles have a strong SPR band in the visible region, while other metals show broad and weak bands in the UV region. Also, the light absorption or scattering of gold nanoparticles is at least 1000 times stronger than the absorption or emission of any organic dye molecule. This makes gold nanoparticles very promising in a wide range of applications, including sensing, imaging, and photothermal therapy. But why near infrared region or NIR? For clinical therapy of tumor under skin and deeply seated within tissue, NIR light is required because of its deep penetration due to minimal absorption by hemoglobin and water molecules in tissues in this spectral region. Thus, NIR absorbing plasmonic nanoparticles are favored in PPTT of cancer.
What all it causes to cell? Laser pulses could induce cell damage via a series of photothermal and accompanied phenomena. Denaturation or breakdown of proteins, cell cavitation, cellular structure rupturing, evaporation of cellular fluid, and bubble formation by shock waves due to particle thermal expansion shown in the video before. Optical breakdown or plasma generation of gold nanoparticles.